Welcome to the alveolar process and extractions. The alveolar process, also referred to as the alveolar bone, is very important in dentistry. It's part of the jaw that surrounds and supports the teeth. It contains the alveoli sockets where the teeth are anchored and plays a crucial role in stabilizing the teeth. The alveolar process is composed of 4 layers. The periosteum, which is a thin vascular membrane that covers the outer surface of the bone. The next layer is the alveolar bone proper, the inner lining of the tooth socket, and appears as a thin white line on radiographs, also referred to as the lamina dura. Next is the dense outer layer of the alveolar bone, called the cortical bone, which is thicker in the mandible versus the maxilla, making it more resistant to resorption in the lower jaw. The rest of the area is filled out with a spongy layer of the cancellous bone. So to recap, we have the outer layer that surrounds everything called the periosteum. Then we have the inner lining called the alveolar bone proper. Then we have the dense outer layer of the cortical bone and the spongy inner layer of the cancellous bone. The features and functions of the alveolar bone is to anchor the teeth via the periodontal ligaments, absorb and distribute forces from chewing and biting, continuous remodeling in response to functional demands like chewing and orthodontic movement. It also supports and maintains facial structure. So if the main purpose of the alveolar process is to house and contain the teeth, what happens when the tooth is gone? A tooth extraction is a process where the tooth is removed from the socket. The bone is no longer stimulated in the area and starts to slowly collapse inwards, resorbing further over time. As more teeth are lost, it will cause the facial structures to change, causing a more sunken-in appearance. There are many reasons why a tooth may need to be extracted. Some common situations are severe tooth decay or infection, advanced periodontal disease, impacted or overcrowded teeth, or tooth trauma and fractures. With a simple extraction, the tooth is fully erupted and intact. The healing can be anywhere from 1 to 2 weeks. With a surgical extraction, it can get a bit more complicated when it comes to fractured or impacted teeth. The healing time for a surgical extraction can be anywhere from 2 to 4 weeks. In some cases, with an impacted tooth, an incision is made and the bone is removed to expose the tooth. The tissues are then sutured up. After a tooth is extracted, it's best to replace it. Options for replacement include dental implants, dental bridges, and partial dentures. A dental implant consists of a titanium post inserted right directly into the bone, where an abutment can be screwed onto the post, followed by a crown that is also screwed on. The implant fuses with the bone in a process called osseointegration, providing a long-lasting situation. A dental bridge can replace 1 or more missing teeth. It consists of the abutment teeth, which are the teeth adjacent to the missing tooth, the pontic, which is the missing tooth, and the crowns that sit on the abutment teeth. A con with the bridge is having to shave down 2 healthy adjacent teeth to replace 1. A partial denture is replacing multiple teeth on the same arch. It consists of the artificial teeth, the gum-colored base, the metal clasps or rings that hold onto the teeth, and the metal or acrylic frame it's made out of. A big con with partial dentures is that they can be uncomfortable and the metal clasps can be seen. The dental implants are the best and most popular option because they look, feel, and function like a natural tooth. And most importantly, they prevent bone loss in the area. They also come in many different options to replace missing teeth. So, if the bone is resorbed and there's not enough room to place an implant, a dental bone graft can be done to regain volume in the area. The bone graft can consist of natural materials like human, cow, or pig bone, along with synthetic materials like ceramics, polymers, bioactive glass, and metallic alloys. Thank you for watching the alveolar bone and extractions.